The anatomical structures of the knee region and the functions and injuries to the ACL by Ahmed Osman and Sidra Ahmed. In this presentation, my partner and I will cover the following: the anatomy of the knee and the bony landmarks, functions of the ligaments, for example the ACL, PCL, LCL, the MCL, the meniscus and the bursa. Also, we will be covering how neuromuscular factors contribute to ACL injuries. Also, the mechanism of ACL injuries and ACL injury prevention. My partner Sidra will be covering the severity of the injury, how the injury can impact general daily life, blood supply, rehabilitation, and special tests. A recent report from Oklahoma's News on the 6th also found that ACL injuries are becoming more common among the NBA and college players. The news source noted that 10 NBA players tore their ACL in 2013. So firstly, we're going to be talking about the anatomy of the knee and the bony landmarks. The knee joint is one of the most complex structures in the body. This is because it allows us to perform various movements such as flexion, extension, medial and lateral rotation. These movements happen due to the functions of the anatomical structures. The knee is a synovial type joint, which means it's supported by the capsular ligament. This ligament is also supported by other ligaments and fibrous growths. They go across the knee joint, therefore forming a capsule. Hi, now I'm going to demonstrate the bony landmarks around the knee joint. So first of all, we have the ends of the quadriceps femoris muscles. So we have the iliotibial tract, which attaches the head of the trochanter to the girdle tubercle. Then we have the vastus medialis, which is right around this region here, and the vastus intermedius, which is here, and then the vastus lateralis, which is here. We also have the sartorius muscle, which attaches here all the way to the pesi serratus, which is right here. Furthermore, we have the meniscus, which sits right on top of the head of the tibia. Here's the lateral meniscus, and here's the medial meniscus. Furthermore, you have the suprapatellar bursa, the prepatellar bursa, the deep infrapatellar bursa, and the superficial infrapatellar bursa, which is right by the tibiotuberosity. The tibiotuberosity. The MCL originates from the medial condyle of the femur and inserts at the medial condyle of the tibia. However, the LCL originates from the lateral condyle of the femur and inserts at the head of the fibula. The PCL originates from the intercondylar eminences of the tibia, which is right here, and inserts onto the medial side of the condyle of the femur, more specifically known as the anterior medial surface. ACL originates anterior to the intercondylar eminences of the tibia, which is right here, where the patella is in the way, which is not really palpable, and inserts to the lateral condyle of the femur and the posterior aspect, more specifically known as the medial surface of the lateral condyle. It is also a ligamentous structure containing fibroblast and type 1 collagen, which makes up the thick connective tissues. Now we're going to talk about the functions of the ligaments, the meniscus and the bursa. As you can see in this picture, you can see how important the ligaments are. It keeps the two bone structures together. A damage to one end will rupture or tear the other end. Okay, firstly, the main function of the PCL is to stop the tibia posteriorly displacing off the distal end of the femur. The main function of the MCL and the LCL ligaments is to ensure that either side of the joint is stable. This allows the joint to flex and extend in the sagittal plane. However, the ACL's main function, with the help of the posterior muscles, for example, the semimembranosus, semitendinosus, is to stop the superior aspect of tibia from being anteriorly displaced from the distal head of the femur. The ACL also plays a stability role with the knee joint during flexion. Studies have proven that 80% of anterior restraining force from 30 to 90 degrees of knee flexion was provided by the ACL. The meniscus stabilizes the knee joints during movements such as flexion, extension, and any other movements in daily life activities or sports. It also acts as a shock absorber and takes in load from the upper leg to the lower leg. The purpose of the bursa is to reduce friction between structures where tendons or muscles passed over by bony prominences near joints during movement. their fluid-filled activities and located sites. The mechanism of injury. Here we're going to discuss how ACL injuries are caused. ACL injuries are caused commonly in basketball, especially when players are landing after taking a shot when they jump. ACL injuries happen when it's an awkward landing. For example, as you can see in the diagram right here, the player has either landed or changed direction, which means the femur is rotating medially and the tibia is rotating laterally. The impact this has is it will cause the ACL to either tear or rupture. Another mechanism could be gender, as in females who they have anatomical differences, which also contributes to ACL injuries. Shoe surface, weather and playing surface as well can also contribute to ACL injuries. So how does this injury actually happen? Well, when a sudden stress is forced to a knee joint while the tibia is in contact with the ground. Furthermore, it increases the high risk of ACL injuries, which occurs mainly in sports such as basketball. A recent report from Oklahoma News also found that ACL injuries are becoming more common among before the NBA and college basketball players. The news source noted that 10 NBA players tore their ACLs in 2013 alone. Basketball players mainly suffer from ACL injuries. This happens when the knee joint begins to flex from knee extension whilst it's in non-contact deceleration situation. The movements that acquire are internal rotation and the valgus movements. According to Bruckner and Kahn, females are twice as likely and are at higher risk of suffering from ACL injuries compared to men. The main reason why this is the case is due to anatomical differences between males and females, which is a great contributing factor, especially to ACL rupture. The differences include smaller ACL within the smaller notch, wider pelvis and greater Q angle, greater ligament laxity, smaller size, different shapes of intercondyle notch. Hormonal cycle is complex and different in women, a risk factor which contributes to a higher injury risk to the ACL is estrogen. Research by Liu 1996 has shown that in the human ACL, estrogen receptors can be seen. According to Ostrak et al., strong predictors of ACL injuries were having a decreased notch, increasing body mass index, and generalized joint laxity and female gender combinations. Injuries in the game of handball, which has a similar playing style and movements as basketball, ACL tears were on the increase due to higher friction coefficient rate, according to Microblast et al. 2003. On the other hand, for sports such as football, the weather and grass surface may also be a contributing factor to ACL injuries. For example, if it rains, then the grass will be slippery, which creates an unstable surface for the players, which can cause sudden movement and may stress the ACL and possibly cause a rupture. Now we're going to talk about how neuromuscular factors contribute to ACL injuries. For instance, lack of muscular power balance, poor muscle receptors, which delays muscular response, lack of in situ contraction in the hamstrings, and lack of flexibility in the quadriceps. Here's a diagram of what's going on anatomically during muscular factors. Okay, the knee is a very important joint because it contributes to many physical movements we perform in our lives, such as walking, going up the stairs, and even working, depending on how physical the job is. In order for our knee to function well, certain muscles help stabilize the knee joint. The quadriceps hamstrings are two muscle groups that play a role in the knee movement. Within the muscle tissues are muscle spindles. They are sensory receptors that pass information to the central nervous system through the sensory system when it detects muscle movement and change in length. From my own experience, I've noticed that people who take the stairs more tend to have stronger quadriceps compared to the people who take the lift. According to Bruckner and Kahn, 2012, to have good functional knee stability, it's vital to have good muscle power between the quadriceps and the hamstrings. Otherwise, it increases the chance of ACL injuries. He also stated that quadriceps contractions increases ACL strain between 10 to 30 degrees of flexion. Adding to this, ACL tensile failure can also occur due to the forces produced by quadriceps contraction. On the other hand, the hamstrings are ACR agonists, so the lack of strength or delayed motor signal and increased flexibility to the hamstrings may increase the risk of ACL injuries. Furthermore, reflective eccentric quadriceps contraction with the weakness of hamstring muscles allows the extensor mechanism to strain the ACL during anterior tibial translation. This can be seen during jump stop landings. Direct contact injuries occur as a result of extensive valgus stress or hyperextension of the knee. ACL injury prevention exercise. You can also prevent ACL injury, and they have been broken down to 4 components: balance training, landing with increased flexion and the knee and the hip, controlling body motions, especially in declaration pivoting maneuvers, feedback during the training exercise. Today we're only going to demonstrate 2 types of exercises. But firstly, let's talk about the factors. Due to many evidence of neuromuscular factors that contribute to ACL injuries, many beneficial exercise programs have been designed to improve neuromuscular control while standing, jumping, and landing. These injury prevention exercises are really vital for the athletes, especially basketball players, because it produces a positive impact on ACL injuries and injury prevention. According to a meta-analysis by Hewitt, 2005, 6 published prevention exercises demonstrated an overall positive effect in reducing ACL injuries, with a total of 29 ACL injuries in the prevention group compared with 110 in the control group. 3 of the programs showed good amount of reduction, while 2 showed positive trends. Now we will perform the one-leg balance exercise. The purpose of this test is to improve stability and strength of the knee joint. To perform this test, stand on one leg, hold on to something around it to help you balance, bend your knees and lower body towards the floor. Ensure that your knees stay in line with your second toe and does not move in front of your foot. You should be able to see your toes throughout. Okay, hold for 5 to 10 seconds. 5, 4, 3, 2, 1. And then return to standing position. Repeat this test 10 to 20 times, at least 2 times to 3 daily. Now we will be doing the balance test. You'll be balancing on a wobble board. This exercise will be challenging and the aim is to control balance. She then squats 3 times. And then to make it harder to progress, a heavy ball gets thrown at her. She does squats and throws it back, and then she repeats this 3 times. As you can see of the pressure of the ACL joint. One more time.